Good morning. In the previous class, we had come up to proton pump inhibitors. We will review the uses of proton pump inhibitors. Proton pump inhibitors are used in the treatment of duodenal ulcer, gastric ulcer, Zollinger-Ellison syndrome, gastroesophageal reflux disease, pre-anesthetic medication, along with megadose pulse therapy, corticosteroids, gastritis, and stress ulcers. We will complete the drugs used in peptic ulcer by discussing about colloidal bismuth subcitrate and triple therapy for peptic ulcer. Colloidal bismuth subcitrate combines with mucus in the gastric mucosa and forms a glycoprotein bismuth complex that coats the ulcer base and acts as a diffusion barrier. So it protects the ulcer base from further attack by acid. It also detaches and kills Helicobacter pylori, which is seen in about 80% of the patients with peptic ulcer, and stimulates the mucosal prostaglandin E2 production, which stimulates mucus production. Pepsin is adsorbed and decrease in its content is seen. So all these actions of colloidal bismuth subcitrate protects the ulcer from further acid attack. Adverse reactions of colloidal bismuth subcitrate include darkening of oral cavity and stools, diarrhea, headache, dizziness, and long-term use of colloidal bismuth subcitrate can cause osteodystrophy and encephalopathy. Sucralfate is a complex of aluminium and sucrose, that is sucrose octasulfate and polyaluminum hydroxide. What happens is, in the acidic pH of the stomach, it polymerizes and gets a sticky gel-like consistency which sticks to the ulcer base and precipitates the surface proteins, thus protecting the ulcer base from further attack by acid. Adverse effects of sucralfate include constipation, dry mouth, nausea, hypophosphatemia, skin rash, itching. Uses of sucralfate: duodenal ulcer, gastric ulcer, reflux esophagitis, gastritis. An important drug interaction here one should notice: antacids, which neutralize the stomach acid, will not allow polymerization. So for polymerization of sucralfate to happen, acidic pH is required. Therefore, sucralfate should not be given with antacids or proton pump inhibitors or H2 blockers. Prostaglandin analogues are used because prostaglandins decrease acid production and stimulate gastrin secretion. Decrease acid production and gastrin secretion. Prostaglandin analogues increase mucus and bicarbonate secretion. So it has a cytoprotective action, promotes regeneration of cells, especially in the ulcer base, inhibits back diffusion of the hydrogen ions, increases mucosal microcirculation. Therefore, the prostaglandin analogues promote ulcer healing. The main use of prostaglandin analogues in peptic ulcer is to prevent non-steroidal anti-inflammatory drug-induced ulcers. This can be a 3-mark question. Give reason. Aspirin is co-administered with MISOPROSTOL. The reason is aspirin can promote gastritis and peptic ulcer. Prostaglandin analogues, by increasing mucus and bicarbonate secretion, they prevent NSAID-induced ulcers. So some of the commonly used ones are MISOPROSTOL, which has these adverse effects: diarrhea, abdominal pain, dyspepsia, nausea, vomiting, postmenopausal bleeding, and skin rashes. Used in gastric ulcer, duodenal ulcer. Most important use is in preventing NSAID-induced ulcers. And prostaglandins, when we discuss in detail, we will tell you it has other uses also, like medical termination of pregnancy. Triple therapy for peptic ulcer. Triple meaning 3. So the combination of 3 drugs are used in the treatment of peptic ulcer, which is the standard treatment today. Helicobacter pylori is a gram-negative bacillus which is seen in more than 80% of the patients who have peptic ulcer. Triple therapy uses 2 anti-H. pylori drugs with 1 proton pump inhibitor for a period of 2 weeks. There are plenty of combinations available. Some examples: amoxicillin 750 mg plus tinidazole 500 mg plus omeprazole 200 mg twice a day. The others are once a day. Or clarithromycin 250 mg with amoxicillin 1000 mg and lansoprazole 30 mg twice a day. Clarithromycin plus amoxicillin plus lansoprazole twice a day. So these triple therapy medications are available as kits. That is 2 packets, each containing one kit to be taken in the morning and 1 at night, just before going to bed, or 1 hour before dinner. So some of the expected or model questions from the topic on peptic ulcer include: classify drugs used in peptic ulcer. Write the mechanism of action, uses and adverse effects of. It can be general, like proton pump inhibitors. 5-mark questions include proton pump inhibitors or a single drug, omeprazole, lansoprazole. 5-mark question again, H2 receptor antagonists or ranitidine. Systemic antacids, non-systemic antacids, or in general antacids. Then triple therapy for peptic ulcer. So for this question, one needs to write what are the different drugs. That is 2 anti-H. pylori drugs and 1 proton pump inhibitor. Give 1 or 2 examples with the dosage and duration of treatment and the adverse effects. Compare and contrast very commonly asked are cimetidine and ranitidine. 2 or 3-mark questions include: why is ranitidine preferred to cimetidine, or what are the advantages of ranitidine over cimetidine? Name 4 anti-H. pylori drugs. Why sodium bicarbonate is not used as an antacid? Why are magnesium and aluminum salts used in combination in antacid preparations? So with that, we complete peptic ulcer.